Recently graduated doctors protested about the lack of progress in the health department, placing them in positions. They argued that the department was dragging its feet while people needed their services. Dr. Sibusisiwe Mancotywa has just been appointed to a post but spent months after graduating without a job. She joins us now. Good afternoon, Doc. Thank you very much for your time. I mean, I grew up in an era where it was unthinkable that a medical doctor would be unemployed. It must have been a very desperate situation.
Yes, I think certainly one doesn't go into medicine thinking that these are the challenges that they'll face. But in more recent years, we've seen that unemployment, particularly after community service, has seemingly worsened.
And Doctor, what do you think is driving that? I mean, the health department gets a budget every year. It should have posts. It knows how many people it needs to treat. It knows how many people it needs to employ. From your understanding, what's been going wrong?
So I think the government does have these facilities in terms of at their disposal, as most of us for internship and community service are already in their system. So they are able to keep track of the numbers. Not sure if the issue is necessarily the funding per se. In order to actually open and release more posts, they have quoted that they're seeing a larger outcome of doctors after things like the Cuban training program has been established. So perhaps that is the issue. But I think that's a great thing to have more doctors that are able to go and serve. We just have to create a greater platform for them to actually be able to do that.
Well, the health minister says it's not for lack of trying. Actually, it's a quote-unquote myth that the government is dragging its feet and he is not delivering on his promise. And he quoted some numbers a few weeks ago saying between January and March 2066 health professionals were appointed.
So I think it depends which province you look at as well. Yeah, because I think certain provinces have been quick to respond. But for example, myself, I'm in KwaZulu-Natal. That's the province where most challenges were encountered as unemployed doctors. So I think it depends on each province and how they run their employment and recruitment process.
There's supposed to be a whole mechanism. You know, government knows about you for a long time because you have to do your internship. And I mean, higher education in doctors, you can only train to be a doctor at a public university. So they've known about you, you know, since you got 19 distinctions in matric. I mean, there must be a way to plan to know that Dr. Mancotywa is now going to have to come into the system, you know, 7 or 8 years after getting all of those distinctions. I mean, in a way, do you think this is just a failure of planning?
Yes, I think we recognize that obviously we are in the system, and I think the government definitely has room to grow in foreseeing that, okay, if I have this batch of doctors that will be qualifying by December, how can we create those posts for them so that there isn't this lag of however many months for them to actually be placed and for them to actually find employment. So I think there definitely is room for them to find strategies to bridge that gap or to find solutions to minimize that time and hopefully remove it completely.
Well, the minister says, look, because of shrinking budgets, because of rising salaries, but also because of claims that people, you know, make against the state because of negligence and other issues. As much as they would want to, it's difficult in that environment to raise or to make available the 2.4 billion rands that he says will be needed if the state was to employ all the available doctors.
Yeah, it's a bit of a catch-22 there, because I don't think healthcare is a basic human right. It should be something that's accessible, and good quality healthcare is something that should be available to everyone. And so quoting things like budget makes it a bit tricky, because budget should not dictate that access, or should not dictate the delivery of healthcare. And I think more especially when you speak about salaries that are on an increase, at the end of the day, the greater or the bigger workforce you have, then the more people you can service. That makes for better working conditions for an already short-staffed, burnt-out workforce. So employing more people will actually improve things and minimize things like claims on negligence, etc. So, yeah.
I mean, Doctor, in a way, you brought this to national attention. You were a big part of that. People are very aware of this now. I think people are appalled that, you know, doctors can be unemployed. Do you think anything's going to change now? I mean, there's a lot going on. There's an election and all of this stuff. Do you think anything's going to change?
Listen, we have to remain hopeful. I think we've, in the recent weeks, for example, after the sit-in and the protests that we've put together, we have seen a response. But I definitely think there needs to be some long-term solutions, because we know that this is something that has been getting worse over the years and happens every year. So as much as we are addressing the issue now, I would hate to see this problem again next year. So we would love to see more long-term and solutions to the problem of unemployment or finding posts for doctors after community service.
Dr. Mancotywa, let's thank you for your time. Really appreciate it.
Thank you so much.
Well, of course, she's one of those hundreds of doctors who, until recently in her case, she was able to get a job, but hundreds of others are still without a job.